Hello and welcome to Workers Comp Unwrapped, the podcast that simplifies workers' compensation for physicians. I'm your host, Max, here to give you clear, actionable insights to navigate the medical legal side of workers' comp. So let's get started. Welcome back to Season 2, Episode 15 of Workers Comp Unwrapped. With me, Max, is Aisha, who has 15 years of experience in the workers' comp industry.
Hi, everyone.
Today, we are talking about identify signs of fraud in claims, from exaggerated injuries to falsified documentation, and how to protect your practice.
Ooh, this is going to be good.
And ready to dive in.
Absolutely, let's do it. This is a topic that can really make or break a provider's practice. It's that crucial to be informed.
Yeah, and the thing is, workers' comp fraud, it costs the U.S. economy billions of dollars every year.
Oh, absolutely.
The National Insurance Crime Bureau estimates it somewhere between $6 and $7 billion annually.
That's right. And think about all that money that could be going towards legitimate claims,
Right.
And better reimbursements for providers like you.
Yeah.
Not to mention, it, drives up insurance premiums for absolutely everyone.
Yeah, it's a ripple effect that impacts the entire system.
Right.
And providers are right in the middle of it.
Mm-hmm.
So let's break down this kind of complex world of workers' comp fraud.
Okay.
Starting with what most people think of first, employees trying to game the system.
Right. It's easy to assume that fraud always involves someone faking a slip and fall. But the truth is that fraud, it can come from so many different directions.
Okay, tell me more.
Yeah. So we're talking about three main categories of fraud:
Okay.
employee fraud, employer fraud, and even, get this, provider fraud.
All done. Provider fraud.
Yes.
Wow. Okay, we definitely need to unpack that.
Absolutely. And each type of fraud has such unique implications for medical providers. So understanding those little nuances is critical.
Okay, let's start with kind of the most common perception, employee fraud. What are some of the things that a provider should be on the lookout for?
Well, you mentioned faking injuries, but it can be much more subtle than that. Exaggerating the severity of a real injury is really common.
Okay.
They might claim that a minor sprain is actually like a career-ending disability.
Yeah, trying to milk the system for as long as possible.
Exactly.
It's frustrating, but as a provider, how can you tell if someone's really exaggerating their pain? Pain's subjective, right?
That's true. It is, and that's what makes it so tricky. But there are, some subtle signs, some red flags that you can watch out for.
Okay.
Inconsistent stories, for one. Like, if the patient's story about how the injury happened keeps changing, that's a big warning sign.
Okay, so they're tailoring their story to whoever they're talking to.
Yeah.
The employer, the insurer, you.
Exactly. Another thing to be aware of is delayed reporting. Legitimate injuries, they're usually reported right away,
Yeah.
But if someone waits weeks to report an injury, it really raises questions.
Unless, of course, they were unconscious or something prevented them from reporting it immediately.
Of course. There are always exceptions, but a delay should always prompt you to just investigate a little further.
Right. What about those Monday morning injuries? Those always seem a little suspicious.
Yes, those are classic. So, for example, someone comes in Monday morning claiming, I hurt my back lifting boxes, but their job description doesn't involve any heavy lifting.
Right.
That's a red flag. Could be an off-the-job injury they're trying to pass off as, work-related.
So it's like detective work, looking for these clues, these inconsistencies that don't quite add up.
It really is. And you also want to consider whether there were any witnesses to the alleged injury, too. If it supposedly happened in a really busy area, but nobody else saw it. Suspicious.
Yeah. What about when a patient's complaints, they seem way worse than what your physical exam shows?
That's a huge one. So if someone is claiming excruciating pain, but your exam shows very minimal findings,
Right.
you really need to dig deeper.
Yeah.
Are they truly in that much pain or something else going on? And that's where thorough documentation of your objective findings, it becomes absolutely crucial.
Yeah. It's all about connecting the dots and looking at the bigger picture.
Right.
But let's move on to another potential source of fraud. Employers. You mentioned they could be involved too.
Yes.
How does that work?
So employer fraud, it often revolves around reducing those workers' compensation costs, sometimes through unethical means.
Okay, so they're trying to save money by taking advantage of the system.
Yeah.
How does that actually happen?
Well, one really common tactic is misclassifying employees. So they might label workers as independent contractors when they're really employees.
Okay.
Or they might put them in a lower risk job category just to pay lower premiums.
Wow, so it's all about manipulating the system to avoid paying their fair share.
Unfortunately, yes. And it's not only unethical, but it also puts their workers at risk if a real injury does occur. And it can create big problems for providers, too. Imagine you're treating someone for a repetitive motion injury, but their employer insists that their job, doesn't involve those kinds of movements. It immediately raises a red flag.
Absolutely. It makes you question the whole situation.
For sure. Another issue is employers downplaying injuries. And then they pressure providers to clear workers for light duty before they're truly ready. They might prioritize profits over their employees' well-being,
Yeah. That puts providers in a really tough spot.
It does.
Especially if that employer represents a significant portion of their patient base. What advice do you have for providers facing that kind of pressure?
It can be incredibly difficult, but it's crucial to remember your ethical obligations as a provider. Your primary responsibility is to the patient's well-being.
Right.
Not the employer's bottom line, You have to advocate for your patients and make sure they receive appropriate care.
Yeah, that takes courage, especially when you're worried about the potential consequences.
It does, but it's the right thing to do. And if an employer is engaging in unethical behavior, you can always report them to the Workers Comp Board or the state fraud unit.
Okay. I'm starting to see how complicated this all gets.
It does, and believe it or not, it can get even worse. Some employers, they don't even carry workers' compensation insurance at all.
Wait, seriously? How is that even legal?
It's not. It's illegal. It puts everyone at risk. If an employee gets hurt, they have no coverage, and the provider could end up being stuck with the bill.
So it's not just about protecting ourselves from fraudulent claims. It's about knowing who we're dealing with in the first place.
Yes.
And making sure that they're operating legitimately.
Exactly. Due diligence is key here. Always verify that an employer has valid workers' comp insurance before you provide treatment. It can save you a lot of headaches down the road.
I bet. This is a lot to take in. Before we move on to provider fraud, I think it's important to acknowledge just how much responsibility falls on providers' shoulders in this system.
Right.
It's like we're detectives, investigators, and advocates all rolled into one.
You're absolutely right. It can feel overwhelming at times, especially when you're just trying to focus on providing quality patient care.
Exactly. And even the most ethical provider can fall victim to fraud if they aren't aware of the risks and how to protect themselves.
Exactly. And that's why we're having this conversation. Awareness is the first step towards protecting yourself and your practice.
Right.
Now, are you ready to talk about the elephant in the room? The possibility of fraud coming from within the healthcare system itself?
Deep breath. Okay, let's do it. What can you tell us about provider fraud?
So this is where things get a little sensitive, but it's a conversation we definitely need to have.
Yeah.
Provider fraud is basically when healthcare providers intentionally manipulate the system for their own gain, usually financial.
Okay, lay it on us. What are some examples of these shady practices?
Well, one common scheme is upcoding. So that's billing for a more expensive service than what was actually provided. For example, billing for a complex procedure when you only did, a basic exam.
Okay, so basically inflating the bill to make more money.
Exactly. Another tactic is ordering unnecessary procedures like tests or treatments that aren't medically justified just to pad the bill.
That's exploiting people when they're vulnerable. It's just wrong. Is there anything worse than that?
Unfortunately, yes. The most egregious form of provider fraud is phantom billing. So that's charging for services that never even happened.
Wow, that's taking it to a whole new level.
Yeah.
I'm guessing that carries some pretty serious legal consequences.
You are absolutely correct. Phantom billing is a serious offense that can result in hefty fines, license revocation, and even jail time.
Wow. Are there any other ways providers might get caught up in fraud, even if they're not intentionally trying to cheat the system?
Absolutely. Kickbacks and collusion are big problems. This is when providers get involved in referral schemes with attorneys or employers to process false claims. It's, that whole you scratch my back, I'll scratch yours kind of situation.
So even unintentional billing errors can land a provider in hot water.
They can. If you're not diligent about your coding and documentation, you could be flagged for an audit and face serious consequences. That's why having a robust compliance program and a well-trained staff is essential.
Okay, this is where I start to feel the panic rising. Aisha, help us out here. What can providers do to protect themselves from these risks?
The good news is there are steps you can take, and they're not that complicated. First and foremost, document everything meticulously.
Okay.
Detailed medical records are your best defense if you ever get audited.
So the old adage, if it's not documented, it didn't happen, really applies here.
Pretty much. You also need to be absolutely certain that every treatment you provide is medically necessary. Can you justify it based on your objective findings? If not, don't do it.
Solid advice. What about referrals? Should we be wary of patients who come in pushing for a specific attorney or a specialist?
Always be cautious in those situations. Do your own research before you make any referrals. Make sure the attorney or provider is reputable and there's no hint of anything shady going on. Trust your gut. If something feels off, it probably is.
What about our staff? They play a big role in billing and administration, so they could be on the front lines of this, right?
Absolutely. Educating your staff is crucial. Make sure they're trained to spot potential red flags and know how to handle any suspicious situations. They can be your first line of defense.
So we're turning our billing teams into fraud busters.
Exactly. And finally, if you see something, say something.
Okay.
Most states have anonymous fraud hotlines, and don't hesitate to report anything that seems off.
All right, listeners, you're hearing it from an expert. Stay vigilant, document everything, and don't be afraid to speak up. This is heavy stuff, but I think we've covered a lot of important ground today. We've talked about the different types of fraud, the warning signs, and the steps you can take to protect yourself and your practice. But before we wrap up this part of our discussion, I want to touch on one more thing that can be a bit of a gray area: medical necessity.
Ah, yes, the million-dollar question.
Exactly.
What constitutes medically necessary treatment?
Right. Because if we're not careful, even well-intentioned providers could inadvertently cross the line into fraud.
You're right, it's a fine line sometimes.
So let's break this down. What are some key things providers should be thinking about when it comes to determining medical necessity in workers' comp cases?
The most important thing is to be able to support every treatment decision with objective findings and clear documentation. Can you articulate why a particular treatment is necessary for this specific patient based on their diagnosis, symptoms, and your clinical evaluation?
So it's not enough to just say, well, I think this will help.
Exactly. You need to be able to connect the dots between the injury, the patient's limitations, and the chosen treatment plan.
Okay.
And all of that needs to be meticulously documented in the patient's medical record.
So if an auditor reviews the case, they can clearly see the medical reasoning behind your choices.
Precisely. Think of it like building a strong legal case for every treatment you provide. You need the evidence to support your decisions.
I like that. What about situations where a patient is requesting a treatment that you don't believe is medically necessary?
Oh, yeah.
How do you handle that?
Those conversations can be tough, but they're crucial. Start by explaining your rationale to the patient in clear, understandable language. Emphasize that your primary concern is their well-being and that you're committed to providing the most appropriate care based on their individual needs.
So it's about educating the patient and helping them understand why you're making certain recommendations.
Right, and if they're still insistent on a treatment that you don't feel is justified, you have to be firm. You can't let pressure from a patient or an employer compromise your ethical obligations or potentially put your practice at risk.
It's that delicate balance again.
It is.
Advocating for your patient while also protecting yourself and adhering to ethical guidelines.
Exactly. And that's where staying up to date on the latest evidence-based guidelines and treatment protocols is so crucial. You need to be confident that your decisions are in line with current best practices.
So it's not enough to just rely on what we learned in med school however many years ago.
Right.
We have to be lifelong learners.
Yeah.
Always expanding our knowledge and keeping up with the evolving standards of care.
That's exactly right. The medical field is constantly changing, and so are the rules and regulations surrounding workers' comp.
Right.
Staying informed is the best way to ensure you're providing the highest quality care while also protecting yourself from potential fraud allegations.
Because even an honest mistake can have some serious consequences.
Unfortunately, that's true.
This is heavy stuff.
It is.
But I think we've covered a lot of important ground today. Aisha, any final words of wisdom before we wrap up this deep dive into workers' comp fraud?
I think the biggest takeaway is that knowledge is power. The more you know about the different types of fraud, the red flags to watch for, and the steps you can take to protect yourself, the better equipped you'll be to navigate the system successfully. And remember, you're not alone in this. There are resources available to support you. Your state workers' comp board, professional organizations, even legal counsel. Don't hesitate to reach out for guidance or clarification whenever you need it.
That's a great point. It can feel overwhelming at times, but there's a whole network of support out there for providers. And if you suspect fraud is occurring, don't be afraid to speak up. report it to the appropriate authorities.
Absolutely. It's a collective effort to ensure the workers' compensation system functions fairly and effectively. By working together and advocating for ethical practices, we can create a system that protects both employees and employers.
Well said, Aisha.
It has been a lot, right?
Yeah.
I think grounding these concepts in some real-world scenarios can really be helpful, you know?
Yeah, having those concrete examples, I think, can make it all click. So what does fraud actually look like in action?
Okay, let's say you have a patient who comes in claiming like a severe back injury from, lifting heavy boxes at work, and they're reporting like excruciating pain. They can barely move, and they're demanding strong painkillers, and time off of work.
Sounds, unfortunately, pretty typical for a workers' comp case.
Right. But here's where it gets interesting. So you examine them, and you find that their range of motion is actually pretty good. There's no muscle spasm, and their pain responses seem, kind of exaggerated.
Okay, so that's a warning sign right there.
Yeah.
Their reported pain doesn't match your objective findings.
Right.
What did you do next?
I started digging a little deeper. I requested records from their previous providers, and I reached out to the employer to verify the details of the, alleged incident.
Okay, and what did you uncover?
Well, the records from the previous providers, they showed a history of seeking treatment for back pain from multiple doctors, often requesting those strong medications.
Ah, so there's a pattern of behavior there.
Exactly. And when I spoke with the employer, they told me the patient wasn't even scheduled to work the day they claimed to have been injured.
Wow, the story completely unraveled. What happened to the patient? Were there any consequences?
So the insurance company, they launched a full investigation. They actually obtained video surveillance footage from the workplace that clearly showed the patient wasn't even there on the day of the supposed injury.
That's pretty damning evidence.
It is. The patient's claim was ultimately denied, and they could even face criminal charges for insurance fraud.
Wow, that's a powerful example of how a provider's vigilance and thorough investigation can expose fraud and protect the integrity of the system.
Right. It's important to remember that fraud is not a victimless crime. It drives up costs for everyone. It makes it harder for legitimately injured workers to get the help they need.
Absolutely.
And it can even damage your reputation as a provider.
Yeah, absolutely. Okay, so that's a pretty clear-cut case of employee fraud.
Right.
But what about employer fraud? What does that look like in a real-world scenario?
Okay, let's say you're treating a construction worker who fell from scaffolding and suffered a serious leg injury requiring surgery and extensive physical therapy, and you're confident that they need at least 6 months off work to recover properly.
That sounds like a reasonable recovery timeline for that type of injury.
It is, but then you start getting calls from the employer.
Oh.
Pressuring you to clear the worker for light duty much sooner.
Yeah, I imagine they were short-staffed and needed that worker back on the job ASAP, right?
That's exactly what they claimed, but when you push back and explain why it's medically necessary for the patient to have more time off, the employer starts making, veiled threats.
Like what? Find a way to clear them, or we'll take our business elsewhere.
Something like that. Yeah, they might even imply that your future referrals depend on your cooperation.
Oh, wow.
It puts providers in an incredibly difficult position.
It does. How do you navigate that kind of pressure? How do you balance your responsibility to the patient with the potential repercussions from the employer?
First, document every interaction with the employer. Note the date, time, and content of each conversation.
So that way, if they try to deny anything later,
Yeah.
you have a record of what was said.
Exactly. Second, stand your ground.
Okay.
Don't let the employer bully you into compromising your patient's care. Your integrity and your patient's well-being are on the line here.
Yeah, it takes courage to push back against that kind of pressure, but it's so important.
It is tough, but you're not alone. Remember, you can always report the employer's behavior to the Workers' Comp Board or the state fraud unit. They're there to protect providers as well as employees.
Okay, so we've covered some pretty intense examples of fraud.
We have.
Well, let's shift gears a bit and talk about prevention.
Mm-hmm.
How can providers proactively protect themselves from falling victim to fraud?
That's a great question. Prevention is key, and it all starts with a robust compliance program.
What does that entail?
It means having clear policies and procedures in place for everything,
Okay.
from patient intake to billing. Make sure everyone in your practice is on the same page and understands, the rules of the game.
So it's about creating a culture of compliance within the practice.
Exactly. Regular training for your staff is also essential. They need to understand the different types of fraud. how to spot those red flags, and what to do if they suspect something isn't right.
Knowledge is power.
Yes,
Equipping your staff to be vigilant is such an important step.
it is. And remember, documentation is your best friend. Thorough and accurate medical records are essential for protecting yourself against a fraud allegation. If an auditor comes knocking, you can clearly demonstrate why you made the treatment decisions that you did.
Documentation provides that all-important paper trail.
It does.
Any other advice for our listeners?
Don't be afraid to ask questions.
Okay.
If something seems off about a claim or you're unsure about a particular rule or regulation, don't hesitate to reach out to the insurance carrier or the Workers' Comp Board for clarification.
Better to err on the side of caution and seek guidance when needed.
Yeah, by taking these proactive steps, you can significantly reduce your risk of becoming a victim of fraud and ensure that you're providing ethical and appropriate care to your patients.
That's empowering. It feels good to know that we have tools and resources to protect ourselves and our practices.
You do. And remember, you have a vital role to play in ensuring the integrity of the workers' comp system.
We're not just doctors. We're detectives, fraud busters, guardians of the system. And as we learned earlier, lifelong learners.
Well said. Now, I know we've covered a lot of ground today, and we still have more to discuss.
Yeah.
Including a deep dive into the tricky world of medical necessity.
Yes, let's unravel that next.
All right, we're back and ready to tackle this concept of medical necessity. It feels like a bit of a tightrope walk sometimes, doesn't it?
It can be. Yeah, even with the best intentions, a provider could make decisions that, raise some red flags if they aren't really careful about justifying those treatment choices. So let's talk specifics. What are some things providers should be thinking about when it comes to determining medical necessity in workers' comp cases?
The most important thing is to be able to support every treatment decision with objective findings and really clear documentation. Can you articulate why a particular treatment is necessary for this, specific patient based on their diagnosis, their symptoms, and your clinical evaluation?
So it's not enough to just say, well, I think this will help.
Exactly. You need to be able to connect the dots between the injury, the patient's limitations, and the chosen treatment plan. And all of that needs to be meticulously documented in the patient's medical record.
So if an auditor reviews the case, they can clearly see the medical reasoning behind your choices.
Precisely. Think of it like building a strong legal case. For every treatment you provide, you need the evidence to back up your decisions.
I like that. What about situations where a patient is requesting a treatment that you don't believe is medically necessary? How do you handle that?
Those conversations can be really tough, but they're crucial. Start by explaining your rationale to the patient in clear, understandable language. Emphasize that your primary concern is their well-being and that you're committed to providing the most appropriate care based on their individual needs.
So it's about educating the patient and helping them understand why you're making certain recommendations.
Right, and if they're still insistent on a treatment that you don't feel is justified, you have to be firm. You can't let pressure from a patient or an employer compromise your ethical obligations or potentially even put your practice at risk.
It's that delicate balance again, advocating for your patient while also protecting yourself and adhering to ethical guidelines.
Exactly, and that's where staying up to date on the latest evidence-based guidelines and treatment protocols, it's so crucial. You need to be confident that your decisions are in line with current best practices.
So it's not enough to just rely on what we learned in med school however many years ago. We have to be lifelong learners, always expanding our knowledge and keeping up with the evolving standards of care.
That's exactly right. The medical field is constantly changing, and so are the rules and regulations surrounding workers' comp. Staying informed is the best way to ensure that you're providing the highest quality of care while also protecting yourself from potential fraud allegations.
Aisha, this has been an incredibly insightful conversation. I feel like I've gained a whole new perspective on the complexities of workers' comp and the important role providers play in safeguarding the system. Any final words of wisdom for our listeners as we wrap up this deep dive into workers' comp fraud?
I think the biggest takeaway is that knowledge is power. The more you know about the different types of fraud, those red flags to watch for, and the steps you can take to protect yourself, the better equipped you'll be to navigate the system successfully. And remember, you're not alone in this. There are so many resources available to support you: your state workers' comp board, professional organizations, even legal counsel. Don't hesitate to reach out for guidance or clarification whenever you need it.
That's a great point. It can feel overwhelming at times, but there's a whole network of support out there for providers. And if you suspect that fraud is occurring, don't be afraid to speak up. Report it to the appropriate authorities.
Absolutely. It's a collective effort to ensure that the workers' compensation system functions fairly and effectively. By working together and advocating for ethical practices, we can create a system that protects both employees and employers.
Well said, Asha. Thank you so much for sharing your expertise with us today. Listeners, we hope you found this deep dive into workers' comp fraud informative and empowering. Remember, by staying informed, being vigilant, and advocating for ethical practices, we can all play a part in ensuring that workers' compensation serves its intended purpose, protecting injured workers and creating a fair and sustainable system for everyone.
Thanks for having me.
Until next time, stay informed and stay safe. Thank you for listening to Workers' Comp Unwrapped. If you found value in today's episode, share it with your fellow medical providers and healthcare specialists. For more information, contact us at lena.klein@medicallienmgt.com or visit our website, medicallienmgt.com.